Paul, we don't have, okay, well, there's people joining now, so we don't have some of our people, I guess.
All right, Kevin, if you want to go ahead and get us started, and I'll get off the agenda and back to our screens.
All right. Good morning, everyone. Thank you for joining us. Happy New Year. First meeting of the year for 2025. And I know it's a chilly one, and we asked you to start a little earlier for these meetings. So I appreciate you being here early and jumping on at 8:30 to start this. So I will call to order our first meeting of 2025. It's January 8th. It's a Wednesday and 8:30 a.m. I'd like to call this meeting of the Health and Wellness Advisory Committee meeting for the City of Charleston to order now. We had committee minutes that were sent out for our December 4th meeting. Paul sent those out. Can I get a motion to accept those meeting minutes, please?
A motion to accept.
All right. I'll take that as a motion to approve and a second. Any discussion on those minutes? Any additions or deletions? If not, all in favor of approving those minutes, please say aye. Aye.
Aye.
Aye.
Any opposed? Okay, the minutes have been approved. Paul, I'm not sure who we have on and who we don't now. I know we were supposed to go to Amy Jackson from MUSC and our DNASC, the program director, but I'm not sure if she is on right now.
I don't see her, and I'm worried that she's on Teams, and so I'm going to reach back out to her. And is Katie on yet?
Yeah.
Oh, there's Amy.
Oh, good. Okay. Give her a second to get on. Okay. I see Amy Jackson has joined us, the program director for NRDNA SC from MUSC, and she's gonna give us a little update on some things. So, Amy Jackson, if you would, please.
Absolutely. I'm trying to share my slides here. Sometimes on Zoom, my MUSC computer doesn't seem to want me to share.
It, let me know if you, I've got the share open, so hopefully you can get into it.
Okay. It looks like it's trying.
If not,
Apologies.
if not, I can bring it up on my end. Let me see if I can bring it up for you, Amy, on my end.
Okay. Thank you. It seems to be loading, but not actually sharing.
So, do you have it
Yes,
now?
Perfect.
I see it now.
Okay.
Thank you so much, Paul.
Okay.
Okay. Hi, everyone. Thanks for having me today. I'm Amy Jackson, the Director of Operations for our Genetics and Genomics service line at MUSC. And we have a population genomics screening program called In Our DNA SC. You may have seen it advertised throughout the community. It's a statewide initiative, and we're aiming to enroll 100,000 South Carolinians by January 31st, 2026. So we have just over a year left of our initial initiative here. But it screens for the CDC's Tier 1 conditions, which include hereditary breast and ovarian cancer, including the BRCA1 and 2 genes. It includes Lynch syndrome, which is hereditary colon cancer, as well as familial hypercholesterolemia or hereditary high cholesterol. And our stance on this is that all of these risk factors are actionable, so it would be very helpful for someone to find out that they do have one of these risk factors. And we also provide ancestry and traits reporting. So you can go to the next slide, Paul. Thank you. And among participants in programs similar to ours around the country, about 1 in 75 people learned that they were at a higher risk for one of these common cancers or heart disease. And 9 out of 10 we found of these individuals wouldn't have had this identified otherwise through their family history alone or through their standard routine medical care. This is a research study, as I mentioned, and so anyone who participates in this, there is a consent process. However, data is de-identified from their medical record and provided to our research network. We partner with Helix, a genomics lab company based in California, and multiple health systems around the country are also doing something similar, and participants contribute their data to community research and research at large. And over time, our goal is that these contributions will help researchers explore new relationships between genetics and certain diseases and other innovative research that really hasn't been possible up until now. So to date, we have 67,550 enrolled in the program. Of those, we've identified so far 709 people who have been identified with a hereditary risk. 468 of those individuals have a risk for hereditary breast and ovarian cancer or hereditary colon cancer, and 238 with familial hereditary high cholesterol. About 65% of those who have screened positive have pursued clinical interventions or at least genetic counseling with us at MUSC. And signing up for this program is completely free. And we also provide a free genetic counseling visit to anyone who screens positive just to help them understand what this result means, have their families tested if applicable or desired, and let them know what the next actionable steps are to make some decisions about their preventive health. One of our goals is also to enroll a population that aligns that of the state of South Carolina. And so we are constantly monitoring our male participation and our racial and ethnic minority participation. Right now, primarily white females in the 50 to 60 age range is the most common participant. And so we're working to diversify that. How can you sign up? You do not need to have already been an established patient of MUSC. Anyone over the age of 18 can sign up, and it's done through MyChart. If you are not already an MUSC patient, you can simply make a MyChart account on the website link, and it will take you to the consent form that you'll sign. And then you'll be provided a few options to provide your saliva sample. You can have it shipped to your house. You can go to one of the MUSC labs throughout the state, or you can come to one of our participating clinic locations. And then in about 60 or so days, you receive a result back to your MyChart with additional information. We can send this out, I imagine, but I just wanted to include here just materials if it's helpful. We have a community outreach toolkit. We have brochures and other handouts that serve as an aid if any of you would like to talk to your communities or other organizations you're engaged with about this program. We also have research coordinators who are happy to come to events and facilitate either a tabling event or a sample collection event. We've done, I think, over 600 events now since we started this program in 2021 at churches, fairs, colleges, universities, and at different events throughout the state. Next slide. And then we've just put our program email and phone number here. You can feel free to reach out at any time if you have an idea for how we can better engage our community, how we can partner or attend an event that you may have coming up to talk to the community about this opportunity. And you're also more than welcome to reach out to me directly. And Paul has my contact info, but I can also share it in the chat if that's helpful. So really just wanted to bring awareness to the program. We're obviously looking to increase our enrollment and participation and open to ideas or any questions and feedback. So thank you.
Any questions? So, Ms. Jackson, a couple of things, I guess. You're looking for about 33,000 more participants, I think, and you're trying to diversify a little bit better because you've got white females participating. How much longer is there a deadline that you need to get that number?
That's a great question. So we're trying to reach 75,000 actually by the end of this month. So we're doing a big push right now. The overall goal of the 100,000 is January 31st of 2026. So just over a year. And then MUSC is discussing what it might look like to extend this program beyond the 100,000 because we do feel it's an important screening initiative that is helpful to continue. But the 100,000 goal is January 31st, 2026.
Okay, great. And the events that you're having, are people actually participating at the events, or are they just registering to do that? What's happening at the events, I guess?
It varies depending on the event. One important piece to note is that you can't have had anything to eat or drink within 30 minutes of providing your saliva sample. So we go to a lot of like fairs or events that tend to have food and bev as a central piece. And it tends to draw the crowds, which is wonderful, but not the most conducive setting to provide your saliva sample. So in those cases, we tend to pivot to they might enroll and opt for the at-home kit to be mailed to them, which is still free.
Okay, great. All right. Anybody else have any other questions? And Amy, if you have those events, oh, I'm sorry, Morgan Huey, I'm sorry, saw your hand.
Thanks, Amy, for sharing this program. So I know you mentioned it's confidential, but for some folks that's still, just providing their data and that, can feel very personal. Is there anything else you would say just to that we could share about how the data would be protected or how it's confidential?
Absolutely. We have a document actually with a few quick bullet points on it for that exact reason, just to help provide a sense of security and ease. Ultimately, there's only one you, right? So how de-identified can your genetic information be? But as far as anything that would be a patient identifier and considered HIPAA is removed from the data that is distributed to the research platform. And it is through a very secure platform that is between MUSC and Helix, our partner. The results are delivered securely directly into our electronic medical record, which is very secure. And so if they have a provider at MUSC, the provider would be able to see this information. However, no one without appropriate access to their medical record would be able to see this. The only other risk that I'll mention, and it's included in the consent document, is related to life insurance. Health insurance is completely protected under the GINA Act. Life insurance, however, if you were to screen positive, there's a risk that your rate could increase or that you would not any longer be eligible for life insurance. So of course, that's a very personal decision that everyone has to make. I'm sorry, the sun is really blaring through my window at the moment. And our stance is that it's worth it to find out ahead of time if you might have one of these actionable risks so that you can prevent it from occurring in the first place. But we understand that that's a very personal decision that needs to be taken into account.
Thanks, Amy. I appreciate it.
Yeah.
Any other questions? Amy, if you have information on those events, if you can get that over to Paul or myself, maybe we can check and see if we can get that in our city newsletters that
Okay.
go out and things like that if you have events that are happening in the Charleston area.
Great. We'll send over a list of upcoming events that we've got in the Low Country, and then I have a link that I can send over that will just have ongoing updates on things are going to be out around the state.
Great. Well, thank you so much. I appreciate it.
Thank you all so much for the time.
All right. And we're going to move on to our community health update. We have Dr. Katie Richardson on with us, please. Dr. Richardson.
Good morning, everyone, and Happy New Year. I may sound like a broken record, but I want to start with respiratory virus season. We have seen a fairly rapid spike in flu infections across the state, really across the nation, but Charleston County is one of those that has a higher what we call ILI or influenza-like illness rate for all those going in to be seen. Almost 8% of all visits in the last week of December were due to influenza-like illness symptoms. That's really following the curve that we saw in the year just prior to or at the beginning of COVID. So it does seem like we have we had lower rates while we were taking the increased precautions, then we had higher rates because folks had not been exposed to flu for several years. And now we seem to be back to similar rates pre-COVID. So we did see 312 hospitalizations in that last week of December. That's almost half of all we've seen this season. And we saw 2 deaths over that week as well. Thankfully, no deaths yet in the Low Country, but we have been in widespread activity. So that's the highest level of activity now for like 4 or 5 weeks. It's mostly influenza A. And we are very much still recommending the flu vaccine. It does protect after 2 weeks. And so there's still plenty of time for it to be effective in helping to prevent flu and for those who still contract influenza to decrease the symptoms greatly and for those at risk to prevent hospitalizations and deaths. So please help us get the word out to get your flu vaccine if you haven't already, and take those precautions like increased hand washing, increased cleaning of frequently used surfaces, social distancing, and for those at increased risk, consideration of mask use when around lots of people. We're also seeing some increases in respiratory syncytial virus or RSV, as well as COVID, although those increases are much slower than we are seeing flu. There's also a recommendation for a COVID booster since September of this previous year, and a recommendation for a 6-month additional COVID vaccine for those who are older or at higher risk. There's also an RSV vaccine for infants, for pregnant women, and for older folks as well. Moving on to, well, in between, I'd like to say, I think Paul just had a birthday. And so I wanted to make sure that we give him a shout out or a very happy belated birthday. And glad you're well and happiness and joy for many years to come. And then switching gears to life expectancy. So many of you may remember that DHEC, now DPH, put out life expectancy maps several years ago. These were shared at the Data Walk. Again, it was at the Royal Missionary Baptist Church in last year. And I did check. Paula asked me to look into when these were done or the data, when the data that was used to make these was collected and when they might be updated. And what I found out is that these were able to be done due to a partnership of several entities through USA LEAP that used data from 2010 to 2015 that provided census tract level estimates of life expectancy. And unfortunately, there's no plan for that partnership to continue. That sometimes happens with funding. And so DPH is in the early stages of trying to replicate the methodology. You can see the methodology at the USA LEAP website so that we can use newer data to put out sort of revised versions of these maps. But I did want everyone to know that certainly we know all that the disparities continue in life expectancy, often in areas that are very close to each other, often due to social determinants of health that we've discussed often on this call, and that these maps are available. They're at the Live Healthy SC community webpage. And they're not only available for the Charleston area, but they're available for all of those across the state that have been put together. So I think I'll stop there. I hope that we'll discuss more ways to continue to collect more recent data that will help to inform our priorities in work towards greater health equity and improving life expectancy in those neighborhoods of Charleston that are lowest on this map, and that will include much of the work that our Healthy Tri-County is doing. And I'll also keep this committee updated as DPH works to use the methodology to revise these maps in the future. So happy to take any questions, and then we can move into some of that discussion.
Thank you, Dr. Richardson. Any questions? You know, it would be interesting with that data being older if we could get something newer and be able to compare the two and see where we are up to date.
Yes.
It would be interesting to see that.
Yeah.
So hopefully we can move forward with something there.
Yeah. Thank you.
All right. Anyone else? Any other questions, comments? Okay, we'll move on to our community health and wellness updates. Does anybody have anything they want to share? Nick, I know we're through the holidays and all. Obviously, we've got warming shelters open and different things going on in our community right now. Any updates from your group?
Thanks ever so much, Kevin. Not really, other than obviously we've continued to work through the holiday period and obviously are continuing to do what we can during this colder season, but nothing really to report. Obviously, the need still remains pretty high, and we'll continue to do so, I think, as we move forward. And I think as we go into this year, we're obviously looking at potential scenarios and what does that mean as we go forward in this year, and obviously planning to make sure that we're able to meet that need as best as possible across our service area, not just here in Charleston, but along the whole coastline as well.
Great. Thank you, Nick. Appreciate that. Anyone else? Jennifer
have
Brush.
an update, or more of a request and update. So, Happy New Year, everybody. Nice to see you. Um, I wanted to just kind of put out there. So one of the teams that we're trying to add across the state and Charleston and Dorchester is an assertive community treatment team. And we kind of do this now, but not to fidelity. It is an intensive team that includes a nurse, a doctor, a peer support specialist, a couple different kinds of therapists, care coordinators. It's just basically where we're wrapping our really most needy patients out in the community, where we're going to serve them in their homes and their communities. And it's a very tight-knit team, small caseload. They staff everything every morning, and it's really a way to help support our patients that may go in the hospital a lot and try kind of keep them on their medications and doing well, keep them in housing and things like that. And we've been advertising for the team lead, which is a master's level therapist, and we also need a therapist that's trained in drug and alcohol treatment and mental health. And we really aren't getting a lot of applications for it, and it's a really great opportunity for a therapist to learn so much about some of our toughest patients to work with, but you're also working with the team every day. It's kind of reminds me when I started, we worked with a team for kids, and when you come in green right out of school, that's really helpful to learn with other folks. So if you're out there and you hear of anybody looking for a position, it's a really neat and interesting position where you'll be out and about, and totally you will learn so much, and it's really 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 helpful for some of our most needy patients. But other than that, just reminding people to spread the word about 988. It's getting busier and busier in both our 988 call centers in our state. Um, we are a primary call center now for half of the state, and the other call center is for the other half of the state. So word is getting out because calls are coming in. But just to remind people, please call and ask for help if you need it. That's all I have.
Thank you, Jennifer Brush. Appreciate that. Any questions for her? All right, I'm gonna call on Dr. Susan Johnson.
Hi, Happy New Year. Great to see everyone. I have an update for the South Carolina Healthy Business Challenge. I put the link in the chat, but we are excited to open applications for our 2025 fellowship program. If you recall, last year we did a pilot here in the Low Country through some funding from Trident United Way. And we now, through our ongoing support from Blue Cross Blue Shield, are able to expand this statewide. So we'll be selecting 2 to 3 fellows from each of our 3 regions, and the application and the website, you can find it there. The application is due on January 31st, and we will kick that off in February. We also have an event coming up. The registration isn't open yet, but we are partnering with the Big Red Barn Retreat in Columbia to offer a 1-day Struggle Well workshop. And the purpose of that workshop is to introduce folks who either are first responders, work for a first responder employer, or work with veterans, to introduce them to that program. It is a free program, and so we're really excited. It's going to be a small group for that 1 day, but we are, if your organization directly works with first responders or veterans, I will be happy to share that information with you. But that's it for now. We're so excited to have an amazing 2025.
Great. Thank you very much. Any questions there? And I pulled it up. It's very easy to get to that schealthybiz.com/join. So take a look at that if you can. Thank you, Dr. Susan Johnson. Anyone else for community health update? Paul?
Kevin, I just want to go back to what we talked about at our December meeting, and that was the I don't know, did that pop up, the healthy needs
It
assessment?
did. Yeah.
Is just that this is now live out in the community. They have got it in all kind of multiple languages. And they're just asking our help. This is coming from Trident United Way, from Trident Health, from MUSC, from Roper St. Francis. This is every 3 years they do this survey. And as we were talking about that life expectancy map in that Dr. Richardson was showcasing, I just think this is in the meantime, this is the greatest opportunity for us right here in the Tri-County to get as much information that we can from our local communities to not only help with the planning on the big Tri-County way, but also to help us identify anything right now that we can maybe look at and work with our hospital systems or healthcare systems to try to make improvements on. So the more we can get this out in our community, or you can get it into yours, whatever chats we got, it's just a great opportunity to share this information. So I sent that out to everybody yesterday, and as soon as I get back from Madison, their flyer and their other information, even some hard copies, I'll pass those along too. But you just click on it. It takes about 5 minutes to do the survey. I did mine yesterday, and it's really not too hard of questions, but it's just trying to get a feel for where do you see the priorities in your community. So you can do it as both as a person in charge, as well as as an individual person. So the more information, the better. And I know that those 4 groups would appreciate all your input to help them to better serve their community as well too. So
Great. Thank you, Paul.
and I see Quentin on. I don't know whether Quentin wants to say anything or not. I know he's in Columbia getting ready for the State House to open. So
now I came back from Columbia yesterday, but I'll head back up there on Tuesday. Thanks, Paul. But yeah, I just echo your sentiments. Please take advantage or take the opportunity to provide your input and share with other folks to provide input on this needs assessment. We do pay attention to it. That's the whole purpose of Healthy Tri-County being established. We didn't want the needs assessments to be a document with data that we collected and it sat on the shelf and collected dust, and we did it again the next 3 years, but there was no action around it. So we built Healthy Tri-County to keep some momentum around what we're collecting and what we're seeing in these needs assessments. So on behalf of Roper, United Way, and the rest of the partners, Trident, who's joined us as a core partner now, we really need your support in getting this out to the community. We'll have a retreat this coming next Friday, I think it is, to kind of game plan for some of the activities that we'll do throughout the year to keep this document alive and breathing and keep some action around it. So thank you on behalf of the other core partners. I guess while I'm talking, I'll just throw out a couple of things for MUSC. Not a lot of activity going, but we did just have our groundbreaking for our new College of Medicine building, which is just off of B Street. For those of you who don't know, we don't really have a dedicated space for our College of Medicine. We have classroom space and labs dispersed throughout the entire MUSC campus. So for the first time in a long while in the history of MUSC, we will have a dedicated space for the College of Medicine itself at MUSC. On that note, last year was our 200th, our bicentennial celebration for technically the College of Medicine, or the med school, as we call it. And so we are going to have, even though it was last year, we're having kind of an event on tomorrow night to kind of close out all of our celebration activities and celebrating that 200th year. We've got small group of folks coming together at the Gilliard Center to kind of celebrate that with the board of trustees and some elected officials and so forth and so on. And I'll close out by saying just a proud moment. Again, MUSC was nominated or named the top hospital in the state by U.S. News and World Report. But just one other piece that I want to throw out is that our pediatric cardiology group over at the Shawn Jenkins Children's Hospital is the #2 program in the nation when it comes to pediatric cardiology. And so I think that's something that we should celebrate and make sure that people know that we have that asset here in the state and in the Charleston area for our most prized possession, our kids. So our peds cardiology group is #1 in the nation. Now they're #2 in the nation in terms of the program, but they're #1 in the nation when it comes to outcomes of that program. So again, that group is to be commended. So just wanted to throw that out there, and glad to be a part of this group once again, going into this new year.
Great. Thank you, Quentin Tompkins. Appreciate everything. And congratulations to MUSC for all they do and all the awards and rankings that they receive. So thank you. Anyone else? I do see that. Oh, go ahead, Paul.
Kevin, I did. Katie Richardson had shared with me that 2 programs that were also, I know we talked about that mental health was looking for some staff, but MUSC has a Turning the Tide Violence Intervention program that is looking for, has several positions open. That those are programs that are really trying to make a difference. And I'm gonna actually see if Katie will jump in and try to rescue me here real quick, what those programs and what the Boeing Center were trying to do.
Sure. And Quentin, feel free to speak up as well. So this is a program that began several years ago at MUSC called Turning the Tide Violence Intervention Program. And it really works to connect with those who may enter the emergency department having been injured, often by gun violence, and being treated there to not only addresses sort of that gun violence or violence victim, but also their social circle, their family and their friends, and really works to help prevent further violence. And it is a support system that can last for months or even years for that person and their community. So there's a number of positions. I don't have it in front of me, but I think they have 3 positions now available that will assist that program advocates for clients. It involves work in the community, often meeting the victim in the emergency department, and then continuing to work with them, providing wraparound support, including educational opportunities and mental health needs, if that's available. Job training really helps to connect that person to resources so that they have a brighter future and a future that doesn't involve violence. Quentin, you want to say anything more about that program?
No, you hit the nail on the head. And I just want to emphasize that these folks come alongside these people when the incident happens. So if they present it into our ED with a gunshot wound or whatever, these advocates will come alongside them at that time and talk with them and try to show them that there's a pathway out and that we're willing to help them and assist them in removing themselves from that situation and hopefully not having that situation repeat itself. So nationally recognized program, evidence-based program. Dr. Ashley Hink is one of our physician leaders that leads up that program. So they do a lot of great work, and dependent upon a lot of grants and things of that nature, but they've been doing a lot of good work out in the community over the past several years.
Absolutely. Yeah. Thank you. And then the other program that I had sent to Paul, and Paul, I hope you can put those in the minutes, is another program associated with MUSC called the Boeing Center for Children's Wellness. They are hiring a person, and I was trying to look for the name quickly and can't find it at the moment, but it is here it is. Handle with Care is a program that was piloted elsewhere in South Carolina, but has now come to the Low Country. It's an evidence-based program that looks at children who have been exposed to violence or trauma. So it connects EMS, police, sheriff, fire department, those who may have gone out to a home or the location of an accident and appreciate that a child was part of the situation, or at least sort of was exposed to what happened, whether that's trauma or illness or whatever may have happened. And so basically it's a coordinator position through the Boeing Center for Children's Wellness that will help to connect those first responders having information and help to share that with the school district. And it's starting with Charleston County School District, to then allow the school district to share with a select number of staff members at that child's school so that they know that that child may need extra support. And so that position is currently posted, and I think they're looking for, someone with maybe a master's level, if possible, if not a bachelor's level, and several years of experience. Dr. Jan Key, who runs the Boeing Center for Children's Wellness, can certainly give more information, but there'll be information with what Paul shares. So several positions that I think are vital to public health in the Low Country. If you can help us get the word out, certainly I think these are positions that would be very rewarding and are very needed in our community. Happy to answer any questions I can about that, or Quentin, if you have anything you want to add about that as well, feel free.
No, I think, Paul, you mentioned maybe having Dr. Key come and speak, as well as you mentioned Amy and in our DNA program. So we were able to get Amy in, but just let me know if you'd like for Dr. Key or someone from her group to come over and present about the Boeing Center for Children's Wellness.
Okay, great. Any questions? Dr. Richardson, is that a state job with state benefits, or who's the employer on that, I guess, on those positions?
That would be a Quentin question. I'm not,
Okay.
I mean, they are full-time positions, grant funded, I believe, but through MUSC. So I assume they come with state benefits, but I'm not positive.
Yeah, I think it's going to be under the university. We have several factions. There's the hospital, which is an authority of the state, but not true state employees. But I think this position is on the university side, which would make it a state employee.
Great. Thank you. Paul, did you have something?
I just also want to, he mentioned it at our last meeting, but Jonathan also, Kessler had reminded me that the suicide prevention program for the updated 2022 stats for the suicide prevention are available from the Veterans Association. So I'm going to try to get him on in the coming months also to do a presentation. And Jonathan, I don't know if you want to add anything in.
Yeah, absolutely. Thank you so much, Paul, and Happy New Year, everybody. Yes, the annual report just came out December the 19th, and right before the holidays, so we've had opportunity to review it since. So we've seen some positive changes in veteran deaths by suicide, particularly with our female veteran cohort. which has decreased substantially, which is remarkable. So a lot of good work being done there. Our homeless veteran population was very much high risk. It still is, but in the 2023 report, that has decreased by about 19%. So some of those are the highlights, but death by firearm remains at the highest method, which certainly is most lethal. So that continues to be a challenge. So here in South Carolina, it's much higher than the national average, and particularly for veterans, of course. So working with gun shops and ranges and things of that nature to look at safe, secure storage in order to counter that. And of course, we provide gun locks to anyone who is interested in that as a inexpensive way of securing firearms within the home, particularly for those that might be at risk. So if anyone is interested in those, we can provide those for free. And then anyone interacting with veterans, or if you're not sure if you're working with a veteran, just simply asking if you have, did you serve? Did you serve in the military? And you're going to oftentimes get a positive response if they had, as opposed to just simply asking if they are a veteran. And we have a lot of resources available for those individuals as well. So Paul, thank you so much. And I look forward to presenting that information. It's just work that, each and every one of us has available to us, not just for veterans, but everybody.
And Kevin, I'm gonna go back on what Katie was saying also, or what Quentin was saying also. We do want to get the Boeing Center for Children Health and Wellness on our board, on our meeting, because we needed last year in January, February, March era. We talked a little bit about childhood obesity or obesity in our state and in our area. And this group here is doing the most in our community to try to deal with all of our school children. And I think it's important for us to all get on board and see how we can help with the what their mission is by supporting them as well too. So I do want to, I'm gonna see if I can get them on in February or March at the latest, so that we can just follow up on that discussion we had last year.
Okay, great. I see Dr. Durst would like to say something.
Yes, thank you very much. I'm sorry I had to step out for a second, but yes, that's the Boeing and the MUSC program is under also the Charleston County Medical Society. Dr. Key is the head, as y'all said, of our school health and wellness committee. So I apologize if you aren't getting some of the information, and I will reach out to her because that committee, we're meeting this week actually. And it would be wonderful. As I've said in the past, we have some wonderful things that are going on, and Dr. Richardson is on that committee too. So if I can help you guys with that, that would be great. Or help maybe more be the liaison with that also. And I could talk to Dr. Key.
Great. Thank you, Dr. Durst.
Thank you very much.
Anyone else? Nick put in the chat just a reminder for anyone needing food assistance to share this link. So if you look in that chat, he has a link to that as well. Anyone else? Well, if not, I just want to say thank you again for all of you for your time, and thank you. I know we started earlier this morning on a chilly morning. I appreciate everybody jumping in. We'll have a little bit more time maybe to start our days now too. So, but I know your time's valuable. I very much appreciate your time with us, and it certainly helps the city of Charleston continue to make our community healthier. So I very much appreciate everybody. If there's nothing else to come before this committee, we stand adjourned. Thank you so much.
Thank you.
Thank you.
Thanks, everyone.
Thanks. Have a great day.